SHO is an advanced diagnostic test for the early detection of Sjøgren syndrome for patients with dry eye. This laboratory test detects the presence of autoantibody biomarkers that indicate Sjøgren syndrome with greater accuracy and earlier in the progression of the disease. SHO is available as an in-office specimen collection kit. This kit provides all of the necessary components to obtain the blood specimen. In this video, we will demonstrate the proper blood collection technique using a simple finger prick. When collecting samples, it's important to take universal safety precautions. Treat all blood specimens as though they are infectious. Wash your hands. Wear gloves. Take precaution to avoid needle injury. Dispose of contaminated waste appropriately. The objective is to collect a blood specimen that will be sufficient to complete the laboratory test. The Whatman sample collection card should contain multiple large, uniform, non-overlapping drops that saturate completely through the card so that they are visible from the back side. To complete the full SHO panel, a sufficient amount of blood is required. The laboratory requires enough blood to garner 18 3mm punches as seen in this example. To begin, remove the Whatman card from the zip-top bag. Leave the desiccant pack inside the bag. Label the card clearly with the patient's name and the collection date. Uncover the Whatman card so that it reveals the filter paper with the 5 circles for specimen collection. Open the card fully so that you can use the area below the circles to collect extra samples. Do not write or leave markings near the sample collection portion of the card. Have the patient stand so that gravity will help direct blood to the finger. If you are right-handed, you want the patient standing on your right side. You will be pricking the patient's right hand. If you are left-handed, you want the patient on your left side. You will be pricking the patient's left hand. This positioning allows your dominant hand to control and apply pressure to the pricked finger. Have the patient rub their hands together to create warmth and enhance blood circulation. If the patient's hands are still not warm enough, have the patient rub their hands under very warm water to stimulate circulation. Next, ready the materials to prepare for the finger prick. Unwrap the bandage. Tear open the alcohol swab. Take the lancet in your hand. Hold the lancet and gently twist off the protective safety cap. To avoid damaging the lancet spring, do not pull the cap directly off. Do not use the lancet if the protective cap is missing. With the safety cap removed, place the lancet aside until ready for use. Steady the patient's hand with your non-dominant hand. With your dominant hand, apply pressure from the top and bottom at the base of the patient's palm to direct blood to the fingertip. Ideally, the patient's ring or middle finger should be used. Press the hand firmly while moving your thumb down to the patient's fingertip. Repeat 2 to 3 times. Clean the fingertip with the alcohol swab provided. With the patient's fingers pointing downward, place the lancet in the middle of the fingertip, slightly off-center as shown here. Be careful not to get too close to the fingernail. With the lancet, apply as much pressure as possible to the fingertip and press the trigger. Once the prick is complete, put down the lancet. Grasp the patient's hand with your dominant hand. Press firmly against the patient's finger with your thumb to pump the blood out. The optimal pressure point is right below the bottom knuckle. Be careful not to press too close to the puncture. Using an overhand grip with your dominant hand, continuously pump the finger. Allow a large drop of blood to form at the fingertip. Wait patiently for a large drop to form. With the Whatman card lying flat on an even surface, allow the drop of blood to drip from the finger. If the drop will not fall on its own, gently kiss the drop of blood to the card. This allows the drop to quickly disperse and fully saturate through to the back. Do not touch the fingertip to the card. Continue pumping the finger to produce additional drops. Do not rush. Some patients may take longer than others to produce the large drops required. When collecting the drops, be sure to place each drop on a new section of the card. Allow enough space so that the drops do not touch each other. Avoid placing drops on top of one another to prevent layering of the blood. Fill in all 5 circles on the card and place additional drops below the circles. If necessary, prick another finger to complete the specimen collection. The goal is to collect enough blood to garner 18 3mm punches. When the specimen collection is complete, apply the enclosed bandage to the patient's finger. As you can see from this completed card, there is a sufficient amount of blood. Each spot has soaked through completely to the backside, and there are no overlapping drops. Avoid touching or smearing the specimen. Allow the card to air dry in a horizontal position at room temperature for at least 1 hour. Drying longer, even drying overnight, will not harm the specimen. You may use the notch designed on the front of the test box to dry the card in the proper position. Keep the specimen away from direct sunlight. Be careful to avoid exposure to environmental conditions that may compromise its integrity. Do not allow it to touch other surfaces during the drying process. Once the Whatman card has completely dried, seal it with the included desiccant pack inside the provided zip-top bag. Completely fill out the test request form with all required patient and office information. Photocopy the patient's medical insurance information. Place the sealed zip-top bag, the completed test request form, and a copy of the patient's medical insurance information into the white envelope, and place it inside the pre-addressed FedEx envelope. Record the tracking number for your reference. Call FedEx for pickup. For your convenience, test results can be obtained either online or by fax. In addition, the test results will always be mailed to the healthcare provider's office. Please indicate your preferred communication method on the test request form. If we may be of further assistance, please contact the MyNicox concierge by calling 855-MY-NICOX or emailing concierge@mynicox.com. Thank you for your time.